when I started specializing in medical hypnotherapy for chronic disease and took classes from everybody, and a lot of the people in today's class, I was actually in their academy, the Hypnotherapy Academy of America, because it was one of the many places I went to find out what is everybody else doing, right? What are they using for chronic disease? And I found that there's about three different styles. I called them in the manual 3 different generations, because that first generation was definitely prevalent like 70 years ago. That second that you'll see was from the 70s, from the 80s. And then what we're going to be mainly focusing on is much more recent. So what I discovered as I was studying was that we have these 3 different ways of working with chronic disease within the NLP and hypnotherapy practices. All right, so you'll have a group so in that first one it says symptom management. In that group, the practitioners, and of course the clients, and most of society, is working under the paradigm that disease is the enemy, that disease is the problem. I actually went to an amazing class last year on trance work, and I asked a question that we were referring to problems, and always, you know, when a client comes in with a problem, don't get stuck right there. There's always a deeper problem to research, et cetera, et cetera. And someone talked about a pain, a back pain or something, and so I raised my hand and I said, so what is the problem behind back pain? And the teacher immediately fell into, well, back pain's the problem. You know, because that's our tendency. When we have a disease, when we have a disturbance in the body, all we want to do and all our clients want to do is get rid of that disturbance. So in that first group, that first generation, the disease is the problem. The strategy is get rid of it. Get rid of the symptoms immediately and as quickly as you can. 3 to 4 sessions preferably, right? And the paradigm under that group is that the body is somehow broken. Something is wrong. Something is wrong with my nervous system, right? Something is wrong with in Parkinson. Something is wrong with my brain. It doesn't create enough dopamine. Something is wrong. And so if you're working under that paradigm, what you're going to do is try to reduce and correct the symptoms. So in this field, what I noticed and what I learned from them is a lot of suggestion work. Suggestion to lower the dial, lower the blood pressure. Suggestions to go into a control room, again, and manage the dials of the body, right? You're correcting an error. Also, just symptom reduction, like putting your hand in an ice bucket and imagining that numbness then coming into the neck pain that you've been having for 30 years, suspiciously recurring every few months, especially around Christmas. Yeah, and then, for example, with NLP, it's noticing the color of it, noticing the shape, changing the shape and the color, right? Or if this area is comfortable and it's a very nice color and this area is a color red, it's moving the color. Different ways of reducing symptoms. Does it work? It can. It can be quite effective. But is it really dealing with the disease? I don't think so. It's almost like turning off the light indicator in your dashboard. Yeah, it no longer bothers you, but has it really resolved what's happening and what's been happening in this lifelong process in your body? In the case, if you guys remember, I mentioned the Renaults. In the case of Renaults, I did the allergy process for the Renaults, for the fingers, and this client had no more Renaults experiences for 2 whole years. The thing is, after 2 years, she did a crazy thing. I finally realized Renaults has a bit of a crazy thing, not taking care of, being a little more risk taker than you need to be. But she did a crazy thing, going outside, very unprepared, wearing pretty much summer clothes when it was very, very cold outside, getting a little nervous that she was unprepared, and her Renaults started coming back again. So yeah, you definitely wipe it out, but if you put the environment, once again, those psychological triggering factors, her Renaults creeped back a little bit. So for me, that indicates we got rid of a symptom, not got rid of the disease or the mental state from that disease. The second generation, which is quite prevalent now, is the generation that defines disease as most disease are caused by emotions. There's actually a book called Deadly Emotions: anger, grief, rage, fear. And the strategy under the second generation is remove the emotions behind traumatic events, find that initial sensitizing event, that event that happened possibly at 5 or 7, whatever age, in a really early age. If you can go into that event through regression therapy and resolve it, you have resolved what triggered the disease. Another part of this generation is I notice that the subconscious is not the friend here. The subconscious is needing to be reprogrammed. First generation is the same thing. The subconscious needs to be reprogrammed. It is self-mutilating yourself. One of the very known specialists in this initial sensitizing event is Stephen Parkhill. He has a training in a book called Answer Cancer. The thing is, when you think about what we looked at, the psychosocial factors, if there's a big T, this probably can be very effective. If there's a little t, right? Not healthy relationship styles, family system issues, not being seen as a child, a lot of those, it's not one issue. And that is where I feel that there's more to be done there. So again, in this one, the strategy will be resolve emotions in whatever way. If I can go back in regression, or I can ask the subconscious to erase all the emotions of all the events that have anything to do with this disease from the past. And again, this generation, once they've done the catharsis, then goes back into suggestions to activate the immune system soldiers to attack cancer, for example, right? The thing about that is, again, cancer is considered an enemy. But is cancer really an enemy? If cancer is really your own cells, you are having a suggestion of a part of you attacking another part of you. So there's some questions arise. Again, is it effective? Yeah. There's definitely been quite a few shifts in diseases and cancers utilizing this method. Does it resolve the underlying factors? Not always. In this case, disease, again, it's a problem. It's something negative that happened in your life. And all your life experiences are something negative that you just want to get rid of, right? So it's almost a victim mentality. So then the third generation, disease is not the enemy. It is not the problem. The disease is actually a guide that points to the real problem, to the situation. Disease is not bad. The body is not broken. My favorite question to ask a disease while in trance, and to ask a body while in trance with my client, is I will ask the body, so, are you broken? And my client will get that question, and then they'll be like, ha, my body just laughed at me. It's not broken, it put it in, it can take it out. So it's a very different paradigm under which we're going to be working. And our strategy is not going to be focused on getting rid of symptoms. If your client comes in with a lot of symptoms and is very uncomfortable, you want to reduce those symptoms. But your main work is going to be on healing the person, working on the lifelong experiences, working on balancing the person, on figuring out the shadows, the unresolved stuff. You want the person, your strategy is for the person to become whole and balanced, to become true of themselves. So our main paradigm under which we're going to work is what we just addressed before. Chronic disease has a very important psychosocial factor that has to be addressed. All chronic diseases. I will have students come in and say, well, I understand how multiple sclerosis has a psychological factor, but my back pain from when I was 20 lifting that couch, that's all physical. That's this disc and that's this da-da-da-da, and it's a stretch, especially when we're looking at ourselves. It's a stretch to understand that they all have psychosocial factors.